You don't have to go it alone. There is nothing to be ashamed about. 1 in 6 adults have diabetes. I think we should all be talking about it. We should talk about how do we live with diabetes? How do we support each other? When I was in college, I knew that I wanted to do something health related. I really didn't know what that was. As an athlete, I really liked the idea of sports medicine or physical therapy. But ultimately, I always was trying to get at the root cause of things and felt like there was no one profession that did everything other than medicine. And so I actually explored the options in medicine after college and looked at all different types of medicine, but found for me, osteopathic medicine was the right match because it had a nice combination of traditional medicine principles combined with the osteopathic principles and a hands-on approach that allowed me to do comprehensive care, care that was very body-centric, and also was allowed to participate in chronic disease management and get to the level of depth that I wanted to do. We now know that 16% of adults in the United States have diabetes. So it's 1 in 6 adults. We also know that for children who get diabetes, up to 40% now have type 2 diabetes. So we have a big and growing problem as it relates to diabetes. Most clinicians feel underprepared to help patients with diabetes, and as a chronic disease, it does not only progress, but it will be there for the rest of someone's life. And so it's important for us to make sure that we have skilled clinicians who are not only able to do preventive care as it relates to diabetes, but also ongoing diabetes management, because it is a common and growing problem. It is a problem that is largely self-managed because the patient has to take care of it themselves, them and their families, but we need to be resources to give them information and support along the process. It is so rewarding when we can help find the thing that helps a patient find the key aspects that allow them to be successful in self-care and allow them to thrive being healthy even though they have diabetes. And I would say because there is such a shortage of clinicians that are comfortable managing diabetes, especially with all the new tools, it is really fun for me to feel like our team and Touro University is being a leader in training people to help patients manage their diabetes, regardless of diabetes type. We have been delighted to see that many of our graduates have gone on to focus on diabetes care, and that makes us excited and hopeful for the future. But honestly, it's integrated with almost every other condition. So when we treat diabetes successfully, we reduce cardiovascular disease, we reduce kidney disease, we reduce cancers, and we improve quality of life. And so, quite honestly, when they see diabetes as a keystone to healthcare, it becomes less overwhelming. Yeah, so if I could give advice to the public about helping them manage their diabetes, I would say, first of all, be kind to yourself. You have diabetes every minute of the day, every day of the year. It is the gift that you didn't ask for, and it's going to be a lot of work, and it's hard. And so let's just call it what it is. It's going to be hard, and you don't have to be perfect. So if you start with one goal, what's the one goal that's important to you? Not important to me per se, important to you, then that allows you to achieve that goal. And when you achieve that goal, you can build upon that success to the next goal. You know, I am on my own journey for healthcare or health myself, and every day is a little bit different. Some days I'm more successful in taking care of myself, other days I'm less. You don't have to go it alone. There is nothing to be ashamed about. As I mentioned earlier on, 1 in 6 adults have diabetes. I think we should all be talking about it. We talk about how do we live with diabetes, how do we support each other. We certainly live in an environment that is not very supportive to healthy diabetes care. You know, I live in a place where soda is cheaper than water. It's hard to get to a gym. We don't always have walkable sidewalks, and we have high processed foods that are caloric dense that are cheaper than the foods that we would make from scratch. So we really have to, 1, be kind to ourselves, 2, don't go it alone, 3, engage your community for support, and then know that we have to take a public health approach so that we all can benefit from a healthier living environment. I think it's important to recognize that as we think about 1 in 6 adults having diabetes, there are no stereotypes. We're all at risk. You get a group of 6, one of us has diabetes. So let's be kind to each other, let's support each other, and let's keep talking, because once we're informed, we have better tools to make change.